Now, with expert analysis on the growing threat of the Zika virus in the U.S., Dr. Claire Panosian joins us now.
Thanks for joining us, by the way. Dr. Panosian is a UCLA professor who specializes in tropical medicine and infectious diseases and a past president of the American Society of Tropical Medicine and Hygiene. So you're very well versed on Zika virus. First of all, can you clarify what Zika is and how you can actually get it? When we first heard about it, there was this perception that only pregnant women or women who wanted to become pregnant had to be worried because they might have a baby with microcephaly.
Well, first of all, Zika is a mosquito-borne virus. It infects people of all ages. And yes, we are most worried about pregnant women because of the risk to their unborn children, but there have been neurologic complications in adults as well.
Well, what about the transmission? Because I know we talked about earlier about how mosquitoes can transmit the virus, of course. But as more news about Zika started to come out, we started to slowly learn as the news evolved, at least here in the U.S., that it can also be sexually transmitted as well.
Absolutely true. The mosquito is the primary way that it will be transmitted, but men, and now women as well, but men for sure can have an inapparent infection. They may be in an endemic country, come back, have sexual contact with their partner, possibly have that virus in their body fluids for up to 2 or 3 months.
So you're saying a healthy adult might have Zika, not even know it, and not even know that when they're bitten by mosquitoes or maybe sexually transmitting this disease, they wouldn't know because they're a healthy adult who's not suffering.
Well, the important point is that 80% of people who are infected have inapparent infections. So this is why it's a very difficult thing to convince people that they may in fact be capable of transmission when they themselves have never been sick. So there's a lot of CDC advice around this. If somebody has been in an endemic country, after they come back, they cannot donate blood for 4 weeks. A male should use protected sex for at least 8 weeks, use a condom. And actually, anybody who's been in an endemic area is supposed to avoid mosquito bites after they return so that we don't infect more of our local mosquitoes.
How has the politicizing of the Zika issue impacted the fight against it?
I have to ask you what you mean by politicizing. I think that we've been disappointed that Congress has not provided the funds that are needed to do a lot of basic work, including surveillance for infected mosquitoes right here in California.
And speaking of the mosquitoes here in California, how likely is it that mosquitoes here can also carry the Zika virus?
We do have Aedes aegypti, which is the tropical mosquito which has transmitted in Brazil and all over South America. We also have a related mosquito called the Asian tiger mosquito, which may be capable of transmitting. So, you know, the highest risk state was Florida. Now it's happened. So Texas, Florida, some of the very humid southern states are at greatest risk, but California is also at risk for what I would call little flurries of local transmission. Now we're already seeing cases in people who have traveled to other areas and have brought it home. So there have been 100 cases in California already.
You know, Peter talked about politicizing, and I know there are a couple of different ways you can go with that, but the clips that we saw just before we introduced you of Senator Marco Rubio, who was pretty upset and visibly passionate about the fact that he's not getting the funds from Congress to be able to do, at least he feels he's not, to do what he needs to do to combat the Zika virus in his state and also to prevent it from spreading to the rest of the United States. He pointed out this is not a partisan issue, and it really is not. I mean, how can a state protect itself and areas protect itself without the funds to combat the mosquito population?
One reassuring point. We do have excellent vector control agencies, for instance, right here in California. So I want to give them a shout out. They do a great job every day. You don't even know it. But those funds go towards many things. I mean, everybody is hoping that someday we will have a vaccine for Zika. That's going to take 2 or 3 years. It's also going to take a lot of money. So there's many ways in which that money needs to be spent to protect many people who are going to be at risk in the future.
And I think when a lot of people think of Zika, they think of microcephaly. Are you concerned that we're going to see a spike in that here in the U.S.?
Well, of course, I think Puerto Rico is a good example. It's U.S. territory, And now it's thought that 1 out of 4 people in Puerto Rico are going to have Zika. They're definitely going to have cases of microcephaly. And there's been at least 1 baby born in the U.S. with microcephaly. So yes, we will see some, but I have a larger concern for the global population. And so we cannot ignore this. It has really moved quickly.
Dr. Claire Panosian, very insightful. We appreciate you taking the time to come in here and answer some of our questions. Thank you very much.
Especially on a Saturday night. Thank you so much.
I thought it was important.
It is very important. Thank you.